Welcome back to Pharmacology for Vocational Nursing 1, and this is week 2. We're going to study the nursing process related to pharmacology. What is pharmacology? Pharmacology is the study of drugs. We are going to study the uses, actions, and effects of drugs, including their molecular effects, their biological effects, and their physiological effects. What? There's a process? Yes, and it's the nursing process. The nursing process is a research-based organizational framework for professional nursing practice. It's central to all that we do as nurses. It encompasses the steps that we take in caring for our patients. You know flexibility is important, and critical thinking will be required. The nursing process is ongoing and constantly evolving. Nurse Redhart says the steps of the nursing process are assessment, diagnosis, planning, implementation, and evaluation. She uses the acronym ADPRI to remember those. Assessment is to estimate or appraise the nature or abilities of something. The first step of the nursing process is assessment. And as an important part of your LVN role, you will collect data, subjective and objective data. What's the difference, you say? Well, subjective data is said by the patient. Now, I use the term said loosely, but they're expressing to us. This type of data has to come from the patient. So it's something that they tell us about pain, feelings, perceptions. We also call subjective data symptoms. Objective data, on the other hand, can be observed by the nurse. It is seen, heard, felt. It can be measured. We often call objective data signs, like vital signs. When we use the nursing process in pharmacology, we are thinking assessment-wise that the first thing that we will do is medication history. We're going to ask the patient, what prescriptions do they take? Are they taking the medication as directed? Are they using any over-the-counter medications? What about herbal remedies? And don't forget, medications can also be applied topically in other ways. So don't forget to ask them about alternative medications. We also want to hear about their response to the medication. Have they had a therapeutic response or an adverse response? Therapeutic response means that the medication is doing what we wanted it to do, what it was expected to do. Adverse responses could be an iatrogenic response, meaning that the medication has caused another disorder, or an idiosyncratic response, which means that the medication has done the opposite of what we expected it to do, or it could be an adverse effect like an allergy, an allergic response. If we have an allergic response, we want to make sure that that is clearly documented on the patient's medical record. Oh, here's a quick check. Read the question. When you come up with an answer, come back and we'll talk about it. So, what did you decide? I hope that you chose assess the patient's pain and pain level. Assess. That's the first step of the nursing process. Note that your question is, what will the nurse do first? Assess. Let's talk about diagnosis. Now, sometimes we get a little distracted by the medical diagnosis. We're learning so much about diseases and disorders, but we don't really look at the nursing diagnosis. And what's the difference? Well, the nursing diagnosis is actually about the decision about the need or the problem of the patient, whether it's an actual problem or a risk for a problem. Let me give you an example. If I break my arm and the bone is sticking out, my actual problem is that I have pain. It's going to hurt. Now, I may be bleeding a little bit, but it's not a terrible bleed. I have a risk for something else. Can you guess what it is? Oh, that's right. I have an open wound. It's infection. So my actual problem is pain. My risk for a problem is infection. And my medical diagnosis is fractured arm. When we look at the complexity here, we see why we have to use our critical thinking and be creative. We also need to make sure that we've collected data that is accurate. When we go through the nursing diagnosis, it also gives us a common place for us to be able to have a conversation with our peers and with other healthcare workers about the patient. We use the NANDA format. That's the North American Nursing Diagnosis Association. You will find NANDA formatted nursing diagnosis in the back of the Taylor Cyclopedic Medical Dictionary. I suggest that you look at the appendices in the back, where you will find them listed alphabetically as well as clustered by disorders. Now, when you go to this format and you look at the NANDA diagnoses, you're going to see what's called the PES. That is the problem, which is the human response related to the etiology of where does that problem come from, as evidenced by the signs and symptoms, which is the data that you've collected. An example would be if a patient came in with diabetes mellitus type 2. The nursing diagnosis may be fatigue. They come to the facility because they have overwhelming fatigue. The fatigue is the problem. It's related to the increased energy demands of the hypermetabolic state, as evidenced by the data you collected showing that they're sleeping 16 hours a day and the patient states are feel exhausted all the time. We use our nursing diagnosis then to develop the plan. The plan is identifying the goals and outcome criteria. They have to be specific and measurable and patient-centered. It's all about the patient. We want to put a time frame on this, and we want to prioritize. Our goals need to be very quantifiable, meaning that we need specific standards of measure. So it's not enough to say the patient will walk or ambulate down the hallway. What we need is very specific measures. The patient will ambulate 2 times each shift a distance of 20 feet by the second day post-op. That gives us a very measurable goal for the patient. Then, once we have our goals set, we're going to set up our steps of what we're going to do to make sure the patient meets the goal. These can be independent things that the patient will do by themselves, collaborative things that we will do together, or things that the patient depends on us to do for them. So, when we're looking at the nursing process related to pharmacology, often we're dealing with medication administration. We will follow the 6 rights of medication administration. Let's talk about those. Another quick check. Take a few minutes. Pause the video. Read the question very carefully. What is the best action for the nurse to take? Okay, I might have given that one away a little fast, but you're going to call the healthcare provider to clarify the instructions. Because the patient is NPO and you know that that means nothing by mouth. You're not going to give that medication IV. Let's look at what's happening next with those 6 medication rights. We're going to give the right medication, the right drug, in the right dose, at the right time, by the right route, to the right patient, followed by the right documentation. Another right is that we want a system analysis. We constantly need to be doing a double check. Our entire system of medication administration is important for us to keep the patient safe. So when we're looking at the system, we want to make sure that we are evaluating and that we are the stop between the error and the patient. Other rights include proper medication storage, proper documentation of things like expiration dates, accurate dosage calculations and preparation, carefully checking the transcription of orders, and everybody's responsibility. everybody's responsible for making sure that the patient has a right to safety. When we are looking at our patients in terms of other rights, what about population specific? For example, maybe your patient is pediatric or geriatric, or they have an immune compromise. We want to make sure that we are following the patient's right to have a prevention and reporting of medication errors, that we've done adequate patient teaching. As an LVN, it's your responsibility to monitor for effects, therapeutic effects, adverse effects, and do some patient education. If you haven't studied the medications and you don't know what they're being used for, you cannot do that effectively. The patient also has a right to refuse medication. There are a couple of exceptions to that, and we'll talk about them in the second semester, but just understand that that is a patient's right. Here's another quick check for us. Pause your video. When you've got the right answer, come back and say, "Hi, I hope you chose check the medication administration record." That would be the first thing, because remember, one of the rights of medication administration is the right documentation. The elements of a drug order include the patient's name, the date the order is written, the name of the medication, the dosage, which includes the size, the frequency, the parameters, and the number of doses, as well as the route of delivery. And if it's a PRN medication, it especially needs a rationale. We don't just give medications for no reason, right? So we need to look for that rationale. The other thing that we will have is the signature of the prescriber, whether that's an actual physical signature or an electronic signature. Notice how the elements of a drug order mirror the 6 rights of medication administration. Finally, after we have implemented and we've given our medication and we've done our documentation, we're going to do the final step of the nursing process, which is evaluation. This is an ongoing part of the nursing process, and what we do is we determine whether the goal has been met. Is the outcome that we were looking for with the patient's care? We monitor the response to the drug therapy, whether that response was the expected response or the unexpected response. And then we follow that with clear and concise documentation. Here's a last quick check for the day. Take a few minutes, read the question, come back and see me when you've got the answer. So what did you decide? I hope that you chose D. Records the completion of an incident report in the patient's medical record. Incident reports are for quality assurance purposes. They are not a part of the patient's medical record. And legally, if you mention that in the patient's medical record, it then becomes a part of the medical record. Your facility policy will be important to follow. Many facilities use a quality assurance form or an incident report that doesn't even have patients' names on them. So be sure that you are familiar with that process. If you have questions about this, please be sure and let me know. Put them in the discussion forum and give me a call, give me a text. I look forward to seeing you soon. Take care.